Alrighty, guys, welcome into chapter 6 today. We're going to be talking about infant CPR and automated external defibrillation, or AED. That's what AED stands for. We'll talk a little bit more about that in a minute. To get started, infant CPR, it's very similar to adult and child CPR, but there's just some minor differences. So you still use RAB-CAB. The biggest difference in your RAB-CAB, which we're going to talk about down here, is that activate, the A in RAB, actually goes towards the end. And we'll talk about why that is here in a minute. So again, when to activate EMS changes, body positioning, where you place your hands and how you place your hands, and then how you give your breaths, all changes just a little bit. So make sure you know all this information for the infant CPR exam. All this stuff is going to be on there. So, I mean, it just goes to show, like, I don't really need to point out specific things because it's all on there. So you guys should know it. Big thing, when you check for responsiveness on an infant, you tap their feet. You don't tap their shoulder like you would on an adult. The reason being, infants' feet are very, very sensitive. And so they will be more responsive to a tap to the foot than they would to a tap to the shoulder. Next, when it comes to activating EMS, so RAB-CAB, responsiveness, we checked responsiveness by tapping their foot. Activate, when it comes to activating EMS, if you are alone, you're by yourself, you are going to give 5 sets of CPR before you call 911, okay? The reason being that we talked about earlier, the most common cause of cardiac arrest in infants is choking. So they are most likely choking on something, and that's why their heart has stopped, and why they're not breathing. So if we do CPR and we're able to get the object out, that will save their life, right? Whereas with adults, CPR is more of a Band-Aid, and we actually need to get an AED and EMS there to save their life. Then we're going to check for breathing like we normally would. Look, listen, and feel. For the timing is the same, no more than 5 or no less than 5 seconds and no more than 10 seconds. All right, so when it comes to chest compressions, you're going to use 2 fingers over their sternum at the nipple line. So this is different than adults because you're using 2 fingers for one. You're using your index and your middle finger. If you do more than that, it's going to be too much for them. So that's why we only use those 2 fingers, okay? And as you guys will see in the infant CPR practical video that I made, I don't love this bending the fingers like this. I like you to be able to keep your arm and your wrist straight when you're doing it. Helps take some of the pressure off your fingers and the muscles in your fingers. We're going to do it on their sternum at their nipple line. With infants, the reason we use the nipple line is because their nipples are in the center of their chest. Unlike adults, nipples can kind of be all over the place. And then our compression rate is the same. It's 100 to 120 compressions per minute. Okay. Then when we do our opening the airway, okay, you're going to do it the exact same. You're going to do the head tilt, chin lift like we did with the adults. And then you're going to give 2 rescue breaths. The biggest difference between breaths for infants and adults is you're going to cover their nose with your mouth. Their mouth is too small for you to get your lips around their mouth to give a breath, so you just cover their nose as well. Whereas with adults, you plug their nose, right? And then when you give your rescue breaths, you're just going to breathe hard enough that you see their chest rise. As opposed to adults and infants, you actually can pop their lungs if you breathe too hard. So you do have to watch for that chest rise and go off of that. If you try and blow much harder than that, you're at risk of popping a lung. So some of those special considerations, meaning those differences between infants and adults, okay? Number 1, you're going to compress the chest 1 to 1.5 inches deep, okay? So infants, we're going 1 to 1.5. Children, 2 inches is the max, okay? So around that 2 inches, but not more than 2 inches. And for adults, we're going to do 2 to 2.4 inches, meaning the minimum is 2 inches, going at least 2.4 inches. Okay, so infants are 1 to 1.5. Again, you're going to use a lower air volume for your breaths because we don't want to pop a lung. If they're choking, which is most likely the case, we're going to need to look for the object while we're doing CPR. If we can see the object in their mouth while we're doing CPR, we can do a finger sweep, so stick our finger in and pull the object out. Okay. And then again, when you are giving breaths, you put your mouth over their mouth and their nose because your mouth is so big, you're not going to be able to get it on just their mouth. All right. Now we're going to talk about infant choking. Okay. Yeah. So when you are taking care of an infant that is choking but is still breathing, okay, this is how we do it. So for infants, you're going to support their neck and their head and lay them on their stomach, and then you're going to give them what's called back blows. So you're going to use the heel of your hand and hit the back of their back in between their shoulder blades. You're going to give 5 back blows, and you're going to hit them fairly hard. It's not soft. It's kind of forceful. Okay. And then you're going to roll the infant face up, and you're going to give 5 chest compressions, just like you would with CPR, on their sternum, at their nipple line. And you're going to repeat that. So back blows, 5 back blows to 5 chest compressions over and over until the object is removed or the infant becomes unresponsive. And if the infant becomes unresponsive, then we're going to do CPR. All right, so we're going to skip over this. I found through some of you guys that on YouTube these videos don't play and you can't hear them. So I will make sure they are posted in the module and you guys can watch them there as far as how to put everything together. All right. So again, if the infant in this situation becomes unresponsive, we're going to immediately call 911. Okay. As long as we're not alone. If we're alone, we don't have access to a phone, then we're just going to go right into CPR, right? And again, we're going to look for the object in the person's mouth while we're doing CPR. So, a couple of things to consider. What is a finger sweep? A finger sweep is when you take your finger and you sweep it inside the victim's mouth to pull out an object that they may be choking on or something that's inside their mouth that shouldn't be. Okay? The only time you should ever put your fingers in an unresponsive victim's mouth is if you can see something there. Okay? If you don't see something there, don't do it. Okay? So a blind finger sweep is exactly that. If you put your finger into somebody's mouth, if you put your finger in somebody's mouth and you can't see the object, you may push the object deeper into their airway. Okay? And so we never, ever, 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 ever want to perform a blind finger sweep. And that is a test question. So make sure you know that one specifically. This next one is also a test question. It's kind of a weird one. So that's why I make sure these two are kind of weird ones. That's why I make sure and name them specifically so that you're prepared. So the top cause of non-food choking deaths in children. So with doing chest compressions and back blows, the whole idea is to create pressure in the chest cavity to push the object out of the child's airway, right? Well, there's one thing that when a child swallows it, pressure is not going to dislodge the object. It's going to make the object grow and fill up their airway, and so it won't come out. And that is a balloon, okay? If a child swallows a balloon and you create pressure inside the airway to try and push that balloon out, well, the balloon just inflates and then it gets lodged and it won't come out. So the top cause of non-food choking deaths in children are balloons. Okay, for emphasis. Anyway, on that last slide, it wasn't going to let me draw it. My computer's being stupid. But for emphasis, the top cause of non-food choking deaths in children are balloons. Okay, however you draw that. Okay, a balloon. So make sure you understand that as well. Okay. So now we're going to talk a little bit about AED and what an AED is and what it's for. So a person's chance of survival improves dramatically through two things, okay? Early CPR and early use of an AED or early defibrillation, okay? So the sooner we get to doing CPR and the earlier we can use the AED, the greater the chances somebody's going to survive, okay? In order to be effective, an AED must be used within the first few minutes. After those first few minutes, it's not near as effective in resuscitating somebody. Okay. AEDs are also available in many public places. So as you're in buildings, it's important, especially in public places, it's important to look for AEDs. Most of the time, they'll be on the wall in like a metal cabinet. They kind of look like this most of the time, square. They'll have like a little glass window where you can see it, and then it will say AED. So if you've ever been on campus and you go look, there's actually one right outside the main gym in the activity center, the HAC. So those, in many public places, you'll find those on the wall. And they are unlocked and they are able for you to access so that you can use them. Okay, so now we're going to talk about electricity in the heart and electrical activity. So our heart follows a natural electrical rhythm. And I'm sure you guys have all seen it in the movies, right? It looks kind of like this. Comes up to a peak, comes down, and then comes up, right? And it goes over and over again. Like this. Okay, that's a normal heart rhythm. That's what it looks like. This is the electrical impulse that makes the heart pump, and then it recovers, fills, and then it pumps again, like that. Okay. Abnormal electrical activity in the heart is what an AED is made to correct. Okay. Now, there are a couple of different rhythms we're going to talk about today that have names. Some of them are shockable and some of them are not. Okay. So the first one we're going to talk about is called ventricular fibrillation, or VF, or also VFib. You may hear me use that. Okay, VFib, ventricular fibrillation. It is the most common abnormal heart rhythm. in cases of sudden cardiac arrest in adults. So those that their heart suddenly stops due to an abnormal rhythm, this is the most common. Okay, all it means is that the organized wave of the electrical impulse is lost. Okay, and let's see. Make sure I got all my information here. So the heart just quivers. It does not actually pump. So let me write that here too. I should have typed this out, but now you'll have it. Heart quivers. Sorry, it looks really weird. So the heart quivers. It doesn't actually pump. Okay. So that natural, regular looking impulse is lost. And so the heart isn't, because it quivers like that, it's not able to actually pump blood. Okay. Not effectively, so where you can get blood to the body. This is a shockable rhythm. VFib is shockable. Okay. Meaning that the AED can correct this abnormal rhythm. I'm getting better at writing this, seriously. All right, so now we're going to talk about ventricular tachycardia. So ventricular tachycardia, or VTach, okay, as we'll sometimes call it, is where the heart pumps too fast to be able to pump blood. So it beats too fast to pump blood. It can't effectively pump blood because it's going too fast, right? These electrical impulses are too close together, okay? So in medical terminology, which any of you who are considering a medical career, I would highly suggest you take medical terminology. It makes a huge difference, okay? So in medical terminology, the prefix tach or tachy, okay, means fast. Whereas, for example, the prefix brady, okay, means slow. So ventricular bradycardia is where the electrical impulses are too slow to effectively pump blood. Now, we're not going to talk about bradycardia too much. There's not a slide on it, but those are the two rhythms you should know. Ventricular tachycardia is actually not shockable, meaning when you put the AED on the person, it's going to say this is not a shockable rhythm. It will say shock not advised, continue CPR. Okay, so ventricular tachycardia is not shockable, whereas ventricular fibrillation is shockable. Okay. Again, as we talked about before, the timing as far as caring for cardiac arrest is very crucial. So CPR is the initial thing we do, but making sure we get the AED there as soon as possible and having it analyzed and possibly deliver a shock is going to be very, very, very important. Okay. As you can see by this table here, with every minute that passes without the body receiving oxygen, the percentage that a person can survive decreases dramatically. Okay. So within those first 3-4 minutes, if we're able to get to CPR and AED, those chances are really high. But after that, it drops dramatically per minute. All right. So again, an AED is an electronic device. Okay. It analyzes heart rhythm, delivers a shock if it's necessary, if it's needed, and it will correct one of the abnormal electrical disturbances, right? This is a test question. Make sure you know this one, what an AED can do. So it can analyze a heart rhythm, can deliver a shock if it's needed or if it's going to help to correct one of the abnormal electrical disturbances. If it's not going to help, it's not a shockable rhythm, then it won't do that. Okay, so an AED attaches to a person's chest. This is what an AED looks like. It has cords that come out that you plug in, attaches to these pads that you attach to the person's chest. It has a built-in rhythm analysis, so the electricity going between the pads, the electricity comes out, goes through this pad, goes through your body, through your heart, back to this pad and back to the machine. The machine is able to analyze, oh, this rhythm is off. it needs to be shocked to be able to normalize. Or no, shock won't actually help. Okay. It will, a lot of these newer AEDs actually will record the data inside the machine, and it's accessible. So when EMS arrives, they can actually access that data to be able to see what the rhythm is, so that if the AED can't fix it, maybe they can. Okay. Some of the common things you're going to see on an AED, it will have an on-off mechanism. This one, the big red button, is to turn it on. It will have pads attached to a cable. So here's the pads and what they look like. They come attached to a cable that plugs into the machine. Okay. It has the ability, again, to analyze the heart rhythm and determine whether it's normal or not, or if it needs a shock. Defibrillation, it has the ability to shock the heart to get it beating normally. It will also prompt you, so it talks to you. Think of it like Alexa or Siri, right? Telling you what to do, telling you when to stop doing CPR, or when to continue doing CPR. They're very smart. They're made very well to make it very easy for you. Okay, and they do have batteries inside them. They're not wall plugged in, which means you can use them anywhere. Okay, that makes them very convenient and easy to use. All right. So as far as actually placing the AED pads on a victim, here's how you do it. For an adult, you will place the first AED pad on the right upper portion of their chest. You're going to go below their collarbone or their clavicle and above the right nipple. As you can see on this gentleman here, goes right here. There's this nipple, his collarbone's up here. Okay? Below the collarbone, above the nipple. The second pad is going to go on the left side of their chest. Okay? So on their left side, it's going to go above their lowest rib, the lower margin of their ribs, and to the left of the nipple. I might even add this is a little bit low. You could put this a little bit higher up into here on the side of the chest and you'd be just fine. That's where the pads go on an adult. So some things to consider when it comes to the AED. First, if the person is wet, okay, or if they're in a large body of water, you want to remove them from the water. Okay, so if they're in a lake, a pool, you're not going to put it on them while they're in that large body of water. Now, if they're in a little puddle, that's okay. The problem is electricity. Water conducts electricity, so anybody who's in that water could possibly be shocked. So you're better off just pulling them out of the water if it's safe. If it's not safe, just go for it. You'll be fine. Okay, but in a large body of water, it's not going to work very well. All right, and you want to dry the person's chest if their chest is wet. For children, they do make these smaller pediatric pads for an AED for smaller people, for infants, children that may fit a little bit better. You can use adult pads on an infant, but they have to be separated, like they can't touch each other. So when these big old pads on an infant, they may be too big to place on an infant. So on an infant, if all you have is adult pads, okay, then you're going to do what this picture shows you, okay? You're going to put one on their chest and one on the middle of their back, okay? That works just fine if you don't have access to pediatric or children's pads. Some other things to consider: if you know or you see the person has a medication patch, remove it before you use the AED. Before you use the AED. If you use the AED while that patch is on them, the medication can actually mess with the conductance of the electricity, and it may not work effectively. Also, if somebody is really hairy, if a man's really hairy and you're trying to attach the pads, they may not stick completely. It has to stick to their skin for it to be effective. So you may have to shave some of the hair on their chest. And we'll talk about the stuff that's in the AED later, but a razor is one of those things that is typically in an AED. Some other things to consider: pacemakers and defibrillators are implanted electrical devices that are used for people who have heart conditions. Pacemaker is used to maintain a normal rhythm. So for people who are prone to abnormal rhythms, a pacemaker will help maintain that normal rhythm. Whereas a defibrillator is for somebody, it's actually a little mini AED that is implanted in the person's body. Now, when it comes to defibrillators, in the event that somebody goes into cardiac arrest, a defibrillator is actually going to kick on and try and shock their heart. It will usually shock 2 or 3 times. If somebody has a defibrillator, it is directly implanted into their heart, and so it should work. It should. That's your best line of defense first for cardiac arrest. So allow the defibrillator to do its job before you try and use an AED. Okay. Now, if you can see the defibrillator or the pacemaker, it's going to be like bulging from the chest. Either right here is typically where pacemakers are. Defibrillators are usually down here. You're going to want to avoid putting those pads directly on top of those devices. Okay. All right. Now, AEDs are inspected periodically to make sure that they're working. They should be. The battery should be checked to make sure that everything's working correctly. This is usually about yearly, sometimes more. Different manufacturers will have different recommendations on that. Okay, and this is the what should be in the AED with the actual AED. So this is what should be in the bag with it. Should have 2 sets of electrode pads, an extra battery, a razor for if somebody has a really hairy chest, a hand towel to dry off somebody if they're wet. Most will come with a mouth to barrier device for CPR, and most will also come with medical exam gloves, some PPE to help protect you. All right, so that's the end of this chapter. With all this information, you should be prepared to take the infant CPR exam. To access that, the code is SCO Badger, spelled just like this with a space. If you have any questions about any of this material, feel free to reach out to me and I'll try and help you the best I can.